New South Wales, residents came out in force yesterday again for testing 119,000 tests done to 8 p.m. last night, and we really want to encourage people to keep coming out for testing. It's very encouraging to know our citizens are listening to the health advice and coming out and getting tested with the mildest of symptoms, or if they're a particular worker and they've been asked to get tested, people are doing that. We had 344 cases to 8 p.m. last night of community transmission. Around at least 65 of those were infectious in the community for all or most of their infectious period. I do want to stress that, as we know, the last 2 days we have seen a surge in the number of cases, and we expect that to continue. But positively, we are starting to see a decline in cases in the Fairfield local government area, but also in the Canterbury-Bankstown local government area. And while the number of cases, especially in Canterbury-Bankstown, are still high, we are starting to see a decline. So that intensive work we've been doing in those areas is starting to have effect, and we ask the community to keep at it, to keep going, and to make sure you stick to the rules. Regrettably, there were 2 deaths overnight because of the Delta strain. A man in his 90s who died in hospital, unfortunately, again unvaccinated, and our heartfelt condolences to him and his family, for his family. We can't imagine what it's like to lose a loved one under these circumstances. And unfortunately, a man in his 30s also died in hospital. Again, our heartfelt condolences and sympathies to his family and friends. We do want to stress that the man in his 30s did have other conditions as well, but notwithstanding that, he obviously succumbed to COVID. As I mentioned, we are starting to see cases decline in both the Fairfield local government area but also the Canterbury-Bankstown local government area, which is a positive sign. In Canterbury-Bankstown, the case numbers are still the highest of any local government area, but we're starting to see a trend that we've seen in the last few days, and we know the intensified efforts we're doing in those areas are starting to bear fruit. However, the adjoining local government areas, or the suburbs adjoining those areas of Bayside, Burwood and the inner west, are starting to have an increase in cases. So they're not at high levels yet, but we don't want them to get higher. So please note that if you live in those suburbs around the Bayside, Burwood and inner west councils, please be on extra alert, come forward for testing. We don't want to have to include you in those local government areas of concern, but we might have to if case numbers don't at least stabilise or start going down. So we're at a stage there now where those decisions will be provided by the health experts in the next few days if we don't see a decline in those 3 local government areas, especially in those parts that are abutting those other local government areas of concern. In the regions, Armidale still has no extra cases, Tamworth still has no extra cases, the Northern Rivers still has no extra cases, which are all positive signs. Unfortunately, in the Hunter, New England area, there were, I believe, around 14 new cases overnight. So Hunter does not look like it'll come out of lockdown later this week. However, we'll await the health advice. But just to know that whilst the first 3 local government areas that I mentioned don't have any additional cases and things are looking very positive, Hunter, New England, unfortunately, isn't looking as positive. And as has been foreshadowed, in Dubbo there were 2 cases overnight, and that follows, which is really important to note, our health experts had told us a few days ago there was some sewage detection in Dubbo, yet we didn't have any cases. So sewage detection has been a good way of identifying or preempting where there may be cases, and after intensive testing and activity, 2 cases have been identified, and therefore from 1 p.m. today, Dubbo will go into 1 week's lockdown, and I understand community leaders and various organisations have already been advised of that, and that will occur from 1 p.m. today. Can I please again, my final message today is the message that Dr. Chant, myself, the Minister and all of us have been talking about is please come forward and get vaccinated. We have passed the 4.5 million jabs. We have a target of 6 million jabs by the end of August, and I do want to foreshadow that as per the Doherty report, 2 doses of 70% vaccination, New South Wales will hit, if we keep the current pace, we hit that around the end of October, and we hit 80% double doses towards the middle of November. Now, according to the Doherty report, that's when life looks like getting back to normal. That's when we have a different approach to COVID. That's when the freedoms that we had before this outbreak are certainly going to be in place, and where we can look forward to having a normal existence. But the challenge for us is obviously how we live in September and October until we get to that double 70%. And with 6 million jabs by the end of August, if we achieve that, there will be opportunities for us in some parts of the community where case numbers are low and vaccination rates are high to allow people to do more than what they do today. And that is something we are working towards, and something that our government is very keen to make possible. So I really want to encourage people to come forward and get tested. I know that some people have been frustrated in the last week in particular, where we've seen an increase in demand in vaccination, where people want to be able to book more efficiently and want to get their jab more quickly. Please know that we're really working hard to provide more walk-in opportunities, more pop-up clinics, and making sure we get advice to the community. So please know that that is an absolute priority for us, because in addition to the strict rules we have about what people can and can't do, the strict lockdown we have in place, vaccines are really key in reducing the spread, but also allowing us to get to those rates where we can consider easing some of what people are having to go through now during September and October. And that will be the most challenging couple of months for New South Wales. How we live until we get to the 70% vaccination, double dose vaccination rate. But can I also stress this point? Myself, the Minister, Dr. Chan, every single member of our government is committed to reducing the case numbers as much as we can. Please know that is always our intention. We know what works and what doesn't work. We're learning as the weeks go by. And we really want to encourage everybody, please stick to the rules. Please know that when people do as they're asked, the results are there. It's just a handful of people doing the wrong thing that really causes grief for everybody, that causes setbacks. I know that the police and health are working together, even until last night and during the day today, to see what further we can do in relation to compliance, because we know that a strong police presence, the ADF support that's on the ground, is making a difference, and we want to make sure we capture those handful of people that continually do the wrong thing. So again, our appreciation that people are continuing to get tested, keep getting vaccinated. If we keep this vaccination rate up, we will get to 6 million jabs by the end of August, and that will give us some opportunities to think about what additional freedoms we can give people in September and October. But clearly, looking forward to that double dose of 70% vaccination, because that's when, according to the best advice we have in the Doherty report, we can start to live life freely and not have the strong restrictions we have in place today.